Singapore is now able to conduct more than 8,000 tests of COVID-19 daily, up from an average of less than 3,000 per day early this month. And the plan is to continue building up testing capacity, which it called a critical enabler of its fight against the virus. And Gwyneth Teo was at a media conference held by the Multi-Ministry Task Force on COVID-19 this evening, and she joins us now to tell us more about it. So Gwyneth, for 4 days we've had less than 1,000 daily reported cases. Some have said the fall in cases is a result of reduced testing of migrant workers. What did the task force have to say about that?
So the Multi-Ministry Task Force, this was actually the first thing that they addressed during the press conference, and they were very categorical in saying that this is not true. It's not that testing has come down and that the cases therefore have been reported as less per day. In fact, as you mentioned, it has actually increased, it actively been ramped up over the course of April from 2,900 from early April to 8,000 per day now. What has changed, however, is the prioritization of testing. So what this means is, in the past, when you had dormitories where there were large numbers of cases, such as S11 dormitory at Punggol, it was important, where you have hundreds of cases, it was important to actually know who had the virus in order to do contact tracing. So if you know which workers have the virus, you can contact their social networks, you can contact their workplaces, and keep an eye on the people that they've come in contact with, and in that way have a sense of how far the virus has spread. And that's actually how we saw the numbers, reported numbers, go up so quickly over the past few weeks. However, now the situation has changed a little bit. Now in this situation where you have a large proportion of tests that have already been performed in dormitories, and a large proportion of those tests have come back positive, you actually kind of know that if you have a worker that presents with flu symptoms or fever symptoms, there's a very high chance that they will test for COVID-19. And so in that situation, it's more important actually to make sure that they get the treatment, that they get the care that they need, rather than wait for the positive test to come back. So what we're seeing here is that even as Singapore is ramping up its testing capacity, because that is the way out of this entire virus situation, what we're seeing here as a direction is that we don't have to wait for that positive test in order to have a strategy about how to deal with the virus. There are still other ways that we can use to fight this virus. We still all need to have personal responsibility. We all still need to respect safe distancing measures, for instance, and that will be part of the suite of measures that will help us out of this virus situation and the circuit breaker measures that Singapore is going through now.
While we can do more tests and we want to do more regular tests, testing is never going to be 100%. Right? So it only takes that one person, that one missed test that may be infected to cause new clusters from happening. So as we plan for beyond circuit breaker, opening up, relaxation of some measures, opening up of some activities, let's still bear in mind the importance of all of us exercising individual responsibility when it comes to wearing of masks, safe distancing, good hand hygiene and personal hygiene. All of these things are still of utmost importance in order for us to be able to sustain this fight against the virus all the way through the end of the year and maybe even beyond.
Gwyneth, how about cases in the community? What is the status on that? What did the task force say?
So the task force did indicate that it does seem that circuit breaker measures are working. We are in the third week of circuit breaker measures now, and they do say that it looks good so far. But what we're really looking for is to make sure that we have single-digit cases of transmission in the community over a number of days, over consecutive numbers of days, and that will indicate that the cases in the community have come down. Only then can we make steps to open up the economy again, to, for example, test migrant workers who work in essential services, make sure that they don't have the virus and let them come back to work in the community, test people who are frontliners working in healthcare with seniors, vulnerable members of the public. If we test them and they are good to go, if they're good to work again, we can start to open up the economy again. Because what testing them will mean that we are very sure that there are very few cases in the community and that they won't form clusters again, and that will really be the strategy moving forward if we're looking at lifting circuit breaker measures.
If we do our part, we will be able to bring the numbers down decisively to a single digit. As we said, when that happens, we will gradually start easing up on the measures and resuming more activities. You are absolutely right that as we go about this opening up of the economy, allowing more businesses to resume, to continue operations, more people to start commuting to work daily, there will certainly be a risk that new infections may come back. And that's why this has to be done carefully in a very calibrated manner, and we will need new enablers for us to go about this resumption of economic activities. Scaled up testing will be one major enabler, and second, technology, where we can do more to identify, track people's movements. Particularly if a case were to emerge, then we will be able to quickly move in to do contact tracing and ring fencing of the close contacts.
We've been speaking with Gwyneth Teo there, who was at the media conference held by the Multi-Ministry Task Force on COVID-19 this evening.